Thanks for the opportunity to come and present to you guys this afternoon. As I noted a bit earlier, it may be the most depleted session of the day, but my slides hopefully will sort of run along the lines of the craze that's happening at the moment around mindful colouring. You know, there won't be a lot for you to read in these slides. What I wanted to do today is try and take more of a patient's perspective of dieting, obesity, the challenges that they face and the community that they live in, and try and identify some of the challenges that are there, because I guess the point that Warren was made, and I'm sure it came up earlier today as well, is that in terms of weight loss, my thoughts are as a dietitian that getting somebody to lose weight can be very easy. I think the challenge is trying to get that person to lose fat and then trying to get them to keep that weight off. So, you know, I think when we talk about weight loss, it's important to think about what it is we're specifically talking about, because weight loss itself can be quite easy. My experience is when I'm talking to patients who are on a diet, is they're not generally the happiest person in the room. They're often disgruntled, they have food envy, they're undernourished, they're struggling with different things. And what really got me thinking about this, I was at a workshop on Monday and Tuesday this week on motivational interviewing, which is a strategy, a counselling strategy that we use for people who are sort of in two minds about whether they want to change or not. And as we're doing this workshop, over the course of the 2 days, I think we did about 10 or 11 role plays within my little group of 3 or 4. And out of those, say 9 or 10 role plays, there was mine, and my thing I wanted to change or was ambivalent about is whether I want to play rugby in the over 35s competition next year. The other issues that came up from other people were all about food, all about weight, all about what to eat at Christmas, whether I should overindulge, etc., etc. So what I'm thinking about when we're discussing this issue is that this is so pervasive in society. You know, you don't have to look far to find somebody who's on a diet, who's struggling, who's gaining weight, worried about body image, etc., etc. And social media, especially for teens, really drives this more and more as well. And there's been a lot of data done down in South Australia by Susan Paxton and her group, where they've been looking at body image dissatisfaction and the impact on social media. And what we tend to find anecdotally is that as body dissatisfaction increases, then the need to seek out a resolution for that becomes more of a concern, and that's where dieting comes in. And there's certainly no shortage of offerings when it comes to which diet you may want to follow. If you go down to Dimmicks or onto Amazon, there'll be plenty of diets there, and the paleo diet's getting a lot of traction these days, gluten-free, dairy-free. I think sometimes as dietitians where we miss the mark is we're just not good as marketing. We haven't found a catchy phrase to try and capture what balanced eating should be and how that can be maintained. So we're certainly competing with people who are, from a marketing point of view, far ahead of where we are. One of the difficulties, I think, with diets is what they do is they set out rules for people to follow. And so, if you're on the paleo diet, then, you might cut out your grains. If you're on a dairy-free diet, you reduce your dairy or you look at other alternative products. If you're worried about carbohydrates, you start cutting those foods out. And so essentially what starts to happen is you start making your decisions around what to eat and when to eat based on these rules as opposed to your normal physiological processes. And I'll come back and talk about that a little bit later, but what these rules do is they are very rewarding in some ways, which comes back to the point that weight loss itself isn't very difficult. And when I was getting ready for the presentation, looking for images, I just Googled diet books. And there were literally hundreds of them. I don't know whether you've ever been to that section of the bookstore, not that there's many bookstores around these days, but they're everywhere. And when people are setting up a lifestyle where they're disengaging from their own physiology about when to eat and what to eat, I think that's when things start to become a bit removed from how we're innately meant to respond to some of this stuff. And so you as a patient, you've gone down, you bought your diet book, you're sitting there, you're cutting out different foods in the diet and that sort of thing. And when you initially start that process, what happens is, if you're following the diet, you're probably losing weight. And what happens there is, in the patient's mind, these rules start to, I guess, gain some credibility. Okay, so I'm losing weight, I've cut carbohydrates out, they must be what's contributing to the weight gain. I've cut the dairy out, that must be what's contributing to the weight gain. And so these rules get positively reinforced through monitoring, through looking in the mirror, through how the clothes are fitting, etc., etc. And as these rules become reinforced, they become what we believe. And so when you talk to people about who are overweight about their beliefs around food, and sometimes we'll get them to write out a list of their food rules, and sometimes it'll cover 2, 3, maybe up to 4 A4 pages. It's mind-boggling, because what tends to happen is when people are on a diet and they, say on a low-carb diet, and they've reached a point and they can't follow it anymore and they jump to the next diet, is they tend to carry rules from one diet to the next. And so most diets are going to be effective, irrespective of which one of the plethora it is. And the reason it's going to be effective is because most diets, if you stick to it, lead to a calorie restriction. They lead to a calorie deficit. So what in my experience, most people who are overweight don't really appreciate is it's not the diet that's actually helping you lose the weight. It's the fact that you're creating an energy deficit. And so this comes back to the point that I made a little bit earlier, is that diets can be very effective at weight loss, but they are very, very poor at keeping it off. And this is the thing that gets people going back for more and buying the next book. I was talking to someone about it, and I was thinking, if dieting worked, there'd only ever be one book, because you wouldn't need to buy the next one, or you wouldn't need to buy the next edition of Woman's Weekly, or whatever it might be. And so this positive reinforcement is very powerful. But what we know is that diets aren't very sustainable. And so eventually, the patient moves on. I'm out of here. I'm not doing the diet anymore. I'm tired of going to afternoon tea with nice banana bread and blueberry muffins and things like that. So I'm going to start eating a little bit more different food, the food that tastes nice. And the food that tastes nice is usually all the food that's excluded on diet. So socially, they're set up to fail in some ways. So you're going along, you've been on the diet, you've lost some weight, come full circle, struggling to maintain that, go off the diet, and what tends to happen is people who are generally morbidly obese or BMI 30, 35 plus or more, generally have a history of yo-yo dieting. So they've been on diets before, they've lost weight, and they've been through this cycle I've been talking about numerous times. And in their mind, they're aware that it's not working, but they really struggle, really struggle to move away into another way of thinking. Because those rules that I was mentioning earlier have been reinforced and reinforced and reinforced, that their belief is that dieting is what helps me lose weight. What happens is when I stop following the diet, I gain weight, so there's another reinforcement in a positive direction for following a diet. And so this is the typical diet cycle that we tend to see. So people make a decision to start a diet for whatever reason it may be. They then start restricting their calories, they create an energy deficit, they get a sense of deprivation. I can't eat what the family's eating, I can't eat what's in the afternoon tea room at work, can't eat the foods that I enjoy. As a result of that, they start to get cravings, and those cravings may be habitual, they may be based on foods that they enjoy eating with people, family, social situations, etc. And so this is the point where, what we tend to think about as willpower should really kick in. That we're wanting people to have strong enough will not to engage in that decision to eat the cake or eat the muffin and those sort of things, but it can't be maintained. And so what happens is they'll eventually give in. And then once they give in, there's this overwhelming sense of guilt that comes with that, because I've broken the diet, you know, I'm not going to continue losing weight, I'm going to gain weight, I need to do something about this. And that guilt, as that cycle gets repeated, and it does many, many, many times for these people who yo-yo diet, is a real sense of shame comes over the person. And that sense of shame is, you know, something that isolates them, something that makes them, you know, feel negative, makes them feel like they're the problem because they haven't got the willpower. And so this is a typical presentation of the person at the before stage. They might be in normal body weight, you know, and what we're seeing, certainly in eating disorders now, is when we say the term eating disorders, most people jump to anorexia nervosa. And what we're seeing now is people presenting at BMIs over 25 clinically with anorexia nervosa. So where we think of anorexia nervosa being very thin, emaciated, BMI 14, 15, that's really, really starting to shift now, and it's starting to shift because people are taking dieting to more extreme levels to try and get to where they want to get to. After the diet, there's a sense of happiness. I've got to where I want to get to, I'm feeling better, but generally it can't be sustained. And as Dr. Ward noted, is that there's numerous papers suggesting that when people lose weight and gain weight through that process, they end up heavier than what they were when they started. So 5 years ago, they would have been better off not dieting at all. It may have helped their weight plateau at that stage, depending on the individual circumstances. So what happens in that process? You're going up, going down, going up, going down in terms of your weight. And what happens with weight loss, in terms of differentiating from fat loss, is most diets lead to predominantly water loss and muscle loss. And that muscle loss, being metabolic, is significant because what happens, it leads to a reduced metabolic rate, which is all fine while you're continuing to follow the diet you've selected. But once you go back to normal eating, or once you reach for the cake, or once you start going out more socially and eating what everyone else around you is eating, it becomes more difficult for your body to burn that food. And therefore you start to increase weight again. But when you increase weight, you're not replacing the lean tissue that's being lost through the process of weight loss. You're starting to increase fat mass. And so even when you get back to your pre-dieting weight, on the scales your weight may be similar, but your body composition has changed for the negative, where your body fat level has increased and your lean body mass is lower. And this is an important study that was done in the 1950s, and it comes back a little bit to what I was mentioning earlier about people at higher BMIs presenting clinically as anorexia nervosa, apart from BMI. There's a study done where they took 36 males back in the 1950s, and there was no My Kitchen rules, men weren't in the kitchen, they weren't interested in cooking. And what they did is they did a 12-month study. In the first 12 months of the study, the first 3 months of the study, they observed their behaviour. In the next 6 months, they restricted their intake and they encouraged exercise for them to lose, on average, about 25% of their body weight. And then in the last 3 months, they re-fed them back up to near where they were at the start of the study. And what they found is, during this period of 25% body weight loss, a lot of the symptoms and a lot of the observations that we see in people with eating disorders were being demonstrated in these men. You know, they were obsessing about food, they were becoming depressed, they were becoming very moody, they were, you know, highly focused on food, calories, they become more socially isolated. So we know that when people aren't getting adequate nutrition, it changes the physiology, it changes the way they think, it changes the way they work, changes the way they engage with people. It has a very profound effect. So I guess the conclusion is that diets don't work. You know, they work for weight loss, but they do not work for fat loss, and they do not work for sustained change, and I think that's probably been made at a couple of points during the course of the day. What's potentially more worrying, and coming back to early intervention and treatment, is the diets we now know to be the greatest risk of people developing an eating disorder, particularly females. And there's been studies that show that it says 50% of teenage girls here think that they're fat. There have been studies in 15-year-olds that show that 68% of a 15-year-old cohort will be on a diet at any particular time. And that's fairly consistent throughout lifespan for females. So you've had a cohort of adult females, around about 2/3 will probably be on a diet of some sort or modifying their diet in some way. What becomes concerning for us in the eating disorder field around this point is that of that 68% who are on a diet, 8% of them will be severely dieting, and that 8% are now 18 times more likely to develop an eating disorder than their peers. Those who are dieting moderately are at a 5 times chance of developing an eating disorder than their peers over the course of 12 months. And with the role of social media playing on, the understanding of a young person's self-esteem, body image, etc., etc. If you've got teenage girls, particularly, you know what I'm talking about. It's very difficult where your image is out there, people are scrutinising it, they're commenting on it, you're feeling insecure, wanting to lose some weight, try and lose some weight, start dieting moderately, and then you start, increasing the risk of moving more towards a clinical eating disorder. And, I think this is a really important point, is that it comes back to the shame that I was talking about earlier, is often with diets, it's not the person that's the problem, it's not their lack of willpower, it's that the diet was never meant to work anyway. And for some reason, this multi-billion-dollar industry just keeps churning them out and churning them out and churning them out, and people keep buying them. Sometimes I think if I wanted to boat on the Bahamas, I'd just sit down and write myself a diet book. And this point was raised a little bit earlier in one of the questions, that around about 66-70% of Queenslanders or Australians are now overweight, so it's a significant problem. And a lot of these people, probably 2/3 of them, are going to be actively trying to diet at the moment with no real clear understanding that it's not going to change anything. If anything, the dieting will be making them fatter. So to pick up on that, we know that diets don't work, so where is our intervention? We've got surgery, but not everybody's going to opt for surgery either. So as Dr. Ward touched on, there's been a real shift, probably in the last 5 years or so, in terms of how we provide nutritional recommendations for people, with obesity, who are not in an acute setting where they might be trying to lose weight for, a particular operation, or reduce their risk of health disease or diabetes, etc. With Health at Every Size, it was really driven by a woman called Linda Bacon from the United States, and there's been 7 RCTs looking at health at every size. And it's really a philosophy that takes the focus off weight and encourages people to focus on just making healthy choices. Try not to cut foods out of your diet, try not to eliminate food groups, just try and really feed yourself what you would feed somebody you care about, or feed somebody else, when they're coming over for dinner, sort of thing. And quite often when we start talking that language to people, they often think, well, maybe, I wouldn't be serving them up a rabbit salad every day at lunch, sort of thing. I wouldn't be serving them up steamed veggies every night for dinner. They'd have more variety. And you'd do that on the premise that it's not going to cause that person to gain weight. So the 7 RCTs that have been done on health at every size show that without weight loss, or with minimal weight loss of around about 2%, they get significant changes and clinically important changes in terms of biochemical parameters, psychiatric measures as well, and also behaviour and lifestyle. So when people implement this type of model, they may not lose weight, but medically they're in a better place, physically they're in a better place, and psychologically they're in a better place. And that's hard to sell to someone who's overweight. Because the person who's overweight wants that, but they also want the weight loss. And when we look at the treatment outcomes for people with binge eating disorder, and Warren touched on it a little bit before with cognitive behaviour therapy, cognitive behaviour therapy is very good at helping people stop binge eating. What it's not very good at is helping people lose weight. And so people can stop their binge eating over the course of 6 or 12 months of treatment, but they're still uncomfortable with the weight that they're at. And so at some point, and I'm not too familiar with the long-term data on this, at some point that person is going to be, really questioning whether they need to go on a diet to get that weight loss back again. Intuitive eating is also a bit of a hot topic at the moment, where they're really trying to encourage people to go back to listening to your body. Eat when you're hungry, stop when you're feeling full. And it's in stark contrast to what people do when they're on a diet, when they have a seven-day meal plan that says on Monday morning you should have this, and Tuesday you should have this, etc. Mindful eating is also very popular at the moment, and we've sort of gone full circle, because you can do mindful eating and mindful colouring in now, which is really taken on. Sure. And all of these things take a change in mindset, and that's where we struggle with patients, because patients who are overweight, they want the weight off. And so the last slide here is really, this is really what we should be focusing on, just the simple things in life. Eating is just too complicated, I think. If we bring it back to the basics, then I think, people would have less of a struggle with food, and potentially less of a struggle with weight, although weight itself is a complex issue. Thanks. There must be some questions after that. Matthew.
Shane, thank you very much. Do you have any helpful advice with regard, and going back to the paediatric population, because you've spoken a lot about individuals having choices, and we've heard about the endocrine side of it, and we've heard about control and things, but we've also heard about the fact that once you're obese, you have a greater chance of staying overweight and being obese as an adult. Now, I see patients coming into the clinic who are 4 or 5 eating bags of chips, chocolate, as they're coming into the clinic. Now, these kids don't have access to money. They have very little access to food. It is all given to them. How do we tackle that problem?
It's a really good question. There's a study, an intervention they're doing at the Mater Children's, where they're with all their obese children, well, not necessarily all of them, but the people who are coming to this clinic, they're working with the parents. So they're trying to get the parents to instill change in the home environment, and help the parents become aware of the impact that the foods that they're providing and the lifestyle they're providing is having on their weight. So I think in that situation, it definitely has to come back to parental responsibility, I think.